Now, ladies and gentlemen, across 2 days, we have debated key issues in healthcare. But the challenge is always, as we were discussing earlier, to take the great ideas and the inventions and turn them into policy and practice. That is a challenge that has been embraced by the health system here in Qatar. Here is one example of an initiative that is all about the development of the next generation of clinicians.
My name is Ribal Turjuman and I live here in Doha, Qatar. I'm a third-year medical student at Weill Cornell.
Ribal came to us and he immediately said, I'm interested in patient safety. So you had the perfect example of somebody who is intellectually curious, has great leadership potential, and already feels constrained by the traditional approaches and wants to push the envelope. Yet again, exactly the sort of spirit we'd like to kindle and support through WISH as a platform.
Can you give me
We created the Academy for Emerging Leaders in Patient Safety a number of years ago. I believe that our role as caregivers is not only to provide the highest quality, safest care possible, but to educate the next generation. So hopefully they come into the world as leaders in a better position.
It's really humbling to be able to see everything come to fruition, and I really can't wait to see the kind of interesting ideas that will come out of these discussions.
It's the person's right to know what's happened to them, like it's their own body, it's their own health. You need to give them the right to know everything about them.
After what had happened, he trusted the surgeon more and he preferred going there because he admitted what happened.
So in this hospital, you actually have an issue. Here's the patient. 7 of you will have to get on this board without killing your patient.
I'm definitely going to be more careful with patients because as a clinical pharmacist, I don't want to cause any harm for the patient, whether it's in research or in practice at the hospital.
I think what shocked me the most was how much we're taught to be competitive and to be correct. And it didn't occur to me that probably is the reason why we're not mindful in our practice.
The patient comes first, last, and they're everything in between.
What makes the Doha experience even more exciting, it is the first global experience that we've had.
What I hope to see is for the students and the faculty here is to see 1,000,000 flowers bloom. There is absolutely no limit to the multiplier effect of having close to 100 people at different levels of leadership and practice be exposed to the same content and telling them you have a whole support system around you.
There you have an idea that came from one of the WISH Young Leaders, and I'm pleased to say that there are other WISH Young Leaders here with us in the audience today, and I know they can be relied upon to take the next great ideas forward. I'd like to invite 2 of the young leaders to join me on stage, as well as to invite back Dr. Don Berwick and to welcome Qatar's Minister of Public Health, Her Excellency Dr. Hanan Al-Kuwari. Please could you join me on stage? So welcome welcome to you all. And the two young leaders who are with us are Amani Al-Haddad, who's a pharmacy student at Qatar University, and Dr. Turki Al-Ahbabi, who's a resident at Hamad Medical Corporation. Your Excellency, I'd like to start with you and to really put the focus. You know, we've talked about things all around the world, but I want to talk now about what you are doing here in Qatar. And congratulations on your recent appointment as the minister. You are in the process of a big expansion of healthcare. How do you do that and keep the focus on quality at the same time?
Thank you very much. Yes, indeed, we're going through a major expansion right now in our health services. And so, for example, primary care has recently opened 3 wellness centers and is due to open 2 more this year. Sidra has opened its doors in May. We recently opened a new communicable disease center. We're going to open at the end of this year 3 hospitals, and next year another further 3 hospitals. So yes, we have a huge expansion program, but the expansion of the facilities is only half the story. We invest very heavily in the development of our human capacity and our human talent. So whether it is through formal education, so investing in the medical schools, so Weill Cornell Medical College, as you've seen, Qatar University, Calgary University, which trains our nurses, but also through the continuous development programs that are available across the whole sector. So we invest heavily in a lot of training, a lot of workshops that focus on quality and safety. We also have a lot of programs, cross-sector initiatives that focus specifically on how can we improve quality, how can we improve safety, and how can we improve the processes in our system. So for example, we have a program which is called Best Care Always, which encourages the hospitals and the facilities to continuously look at ways in which they can provide the safest and most effective care. We have a program called Stars of Excellence, which rewards our staff for the programs they do around patient safety, around patient experience, around innovation, safety. And we also have a number of programs that look at patient experience and how can we continuously reinvent the way in which we provide care in order to make the experience much more efficient for our
And
patients.
what are the particular challenges, as you have here in Qatar, where your health workforce, many of them will be expatriate, they may come and go, your patient body also may be part of a transient population?
Yes, well, this makes developing our own capacity even more important. Our workforce is a transient workforce, however, it is one that has a very low turnover. So it means that we're doing something really well. Our staff turnover is extremely low, and we continuously invest in these staff. They know that they're getting in Doha the best programs available across the world. Our education system is underpinned by very strong programs. The residency program is accredited by ACGME, which means that the residents that graduate from Qatar have equal residency program as though they were graduated from the US or from Europe. And a lot of our nursing education programs are also accredited by the American Nursing Association, which means that our workforce do truly get world-class training and development here, and that reflects directly on the patient care and on the quality of the patient care that they deliver.
Well, let me turn then to the 2 young people who represent the future of that homegrown workforce, and start with Dr. Turki, because you are a young resident here in Doha. You both took part in the Patient Safety Academy initiative. What did it mean to you?
Let me just start by saying it's a privilege and it's an honor being here in this summit and being part of this event. Going back to your question, my participation in the workshop that happened last March was one of the most inspiring, most enlightening, and most mind-opening experience that I've gone through. We actually discussed in that workshop many elements that the physician, from a physician perspective, that needs to concentrate on and focus on when dealing with patients. And even applying these values and these elements outside of the healthcare system. What was very enlightening in that workshop is that we had actually a first line or a close experience with the families that actually have gone through these experiences. And that was actually heartfelt, and it was very emotional for them to share these circumstances and these incidents and give us their perspective, because this actually gives us an idea on how to improve in terms of our service, in terms of our communication with our patients, in terms of delivering the best care in our system.
So it brought you closer to the patient experience, and indeed the patient's family's experience. Amani, it's interesting, the workshop also, because there were doctors, there were nurses, there were pharmacists such as yourself in there. Normally you don't learn together, and yet you work together in those teams.
Well, nowadays it's the opposite. We get those IPE, which is called interprofessional education trainings before we graduate. So we meet with the different students from different medical backgrounds on a regular basis to learn from, with, and about each other. And those experiences were eye-opening experiences where we get to know other professions more, to learn more about our roles and understand how much we just give to a patient case. And the patient safety workshop was another unique IPE experience, I would call, because we were taught those patient safety initiatives theoretically, but when we heard how those patient safety initiatives changes whenever patient tells us a story in different situations and contexts, we really got those feelings of how much it's important to apply this. And personally speaking, after this workshop, I started applying this into my practice every day. And to some extent, I've taken this with me abroad, where I had like my 1 month training in Scotland, and I did work with patients with profound multiple learning disabilities. And at that time, I started realizing how much those patient safety and miscommunication of healthcare providers with the patients can impact their quality of life and all these things. So it's luckily nowadays we get those trainings where we get, as an interprofessional team, doctors, nurses, paramedics to some extent, and also.
Don Berwick, these are young people. This is a minister with the real desire to make things better, and yet we know that in so many parts of the world, for different reasons, that just seems very, very difficult. I wonder where you have seen successful change in healthcare. How has it happened? What has made it possible?
Well, I'll start right here at Hamad. I am so deeply impressed by what Hamad has been doing now for a number of years. I had the privilege of working with the system now for close to 5 years. It's a model. You're seeing pervasive change. It's quite deep. Our congratulations on your recognition. And the words you're using to describe your experience are about new ways to see, new eyes. We're having youth open their eyes and talk in a way they wouldn't otherwise have been able to. That's deep cultural change, and it's here. There's constancy of purpose in this organization to make a difference. You cannot walk into that organization without feeling the intense commitment to continual improvement as a strategy. There's an investment being made, not just in the course you took, but there are fellows being developed at Hamad. There are measurement systems. There's a whole new level of transparency. It's very impressive. It's rare to find an organization that has this level of momentum at this scale in the world. It's a leadership issue, and you will find in Dr. Anand and her colleagues a sense of intense commitment to create a system that allows these people to thrive as learners and improvers. It's quite something. The results are there. I don't know if people here are aware, for example, of the QUES, the Qatar Early Warning System, which has come out of the innovative environment and is probably now nearly an international standard for early detection of deterioration of patients. The work, the Best Care Always work is taking hold. I think the leaders at Hamad would be the first to say how far they have to go, but this is a very good example of leadership meeting the workforce on a platform where they both can drive change.
And Dr. Hanan, you're going to remain in that role at Hamad Medical Corporation and with your role as Minister of Health. I mean, is that part of the idea, that to make make the two joined up and continue to be that way?
Yeah, we are integration of care, and the word I used recently is harmony. So harmony is incredibly important, and for us to achieve harmony and integration of care, we need to work together in partnership. So whether it's ministry, Hamad, primary care, the patient does not care where he's landing, whether he lands in the door of a primary center, whether he lands in Sidra Medical Corporation, Sidra Center, or whether he lands in one of the hospitals in Khord and Dukhan. So for the patient, it doesn't make a difference. So for us as healthcare providers, we need to take off these silos and think about the patient pathway and the experience of the patient more than anything. So with that in mind, the next phase of our development will really focus a lot on quality and safety, and we'll focus on initiatives that are around public health, which will engage all the hospital providers. We want to shift mentality from sickness to wellness, and that's what you see in the wellness centers for those who visited them. So in order to be able to deliver on quality and culture, a partnership across organizations are very important. And one example of partnership is the Academic Health System Partnership. So about 5 years ago, Her Highness launched an initiative which brought together all the different providers with the universities around one table to talk about our priorities for research, our priorities on education, and how can we take advantage of our joint resources, our joint human talent, our joint financial resources to focus our strategies around the areas that make the most difference for our patients. And some of the programs that we decided jointly that we will focus on are cancer, cardiovascular health, diabetes, so these are road traffic accidents. So there's a few programs that now, as a system, we look at, and that's what we would like to encourage at the next level.
And if I asked you, and I know this is hard, but if I asked you to choose one that you'd really like to feel that by the time, you step down from your post, that you feel, what would give you the most pride to think, I made progress on that?
That's a very difficult question. I'd like to see people healthy. I think that's what I'd like to see. And it's not about building hospitals or building capacity in terms of a hospital, but I would like to see people healthy. So I'd like to see a population that's healthy, does not need to go to hospitals as much as they do. I'd like to see a population that's fit, that does not have diabetes, that does not suffer from cardiovascular health. So prevention is very important. So I'd like us as a country to be much more active when it comes to prevention and public health.
Yeah. Don Berwick. We were talking about people coming into the medical profession, to the healthcare profession with new eyes, and yet, so often, you see things very clearly when you enter, and then the weight of established practice and the way things are being done, history, culture, just can start to flatten that, and you can start to lose the clarity or the purpose that you have at the beginning. How do you prevent that happening?
It's a never-ending process of maintaining an environment which encourages learning. I ask our colleagues here, why does it matter to you that you become involved in this process? What does it mean to you?
Given the physician perspective, going back years, 5, 6, 7 years back, the emphasis was on delivering the healthcare service and then full stop. For us as physicians, I think the emphasis on being a relationship other than just it's a simple transaction, and communicating with the patient as a relationship between the physician and the patient emphasizes the whole point of change and the whole point of these kind of workshops. It just brings up these values and these elements that we might take it as forsaken, and it's understandable that physicians should have it, but we have to emphasize on it. Simple values like patient-centered care, transparency, empathy, and compassion about your patient These kind of things to work on and to think about as a physician is, I think, the pillar of having this relationship between the patient and the physician.
Quality is not a project, it's not a program, it's a way to be, in which the words you're hearing here about relationship, Avidas Dhanabedian, the great earlier pioneer in this field, said quality is love. And the sustaining force here is this kind of meaning you're hearing, and that's, you just can't, it's got to be constantly tended to and infused from the leadership level.
Yes, and obviously you go into this profession because you feel that, otherwise you wouldn't. But, Amani, it's still useful to have those reminders, like that workshop, of what are the values that are right at the core of your vocation.
Yes, definitely. Like those things, like and reminders we get through those workshops we attend, it makes us, like, empowers us in the future. Because I believe, like, since we're young, like whatever we learn now, we'll be practicing this in the future. And I always start with Qatar 2030 National Vision, where human development is a great part of that. So. I like students being empowered and having skills improved. Will, at the end of the day, they will end up having just more human development. Will be ending up having this vision accomplished. And if I take it from my profession part, like I see the local part in my profession is very minimal. So this is the first thing I recognize whenever I go into workshops or those things. So when I see this thing, I just visualize, like, in the future, I just want to have more leaders like myself staying in my place, learning the same things, or like in more advanced way. That's why I see, like, those reminders and workshops are very useful to us as students.
Dr. Hanan and Don, I want to ask you both about the balance between having the sort of institutions which take a good idea and implement it everywhere they can, and yet not being too uniform, being flexible enough to be able to say, okay, this is completely different from what we do, but we'll give it a try.
You have a point. I mean, what you learn in the formal education is for you to use. So it should be flexible so that you can use it anywhere else. So when you have a change program or when you have a change process, if it's not adaptable to wherever you are, then it's useless, because the purpose is for you to improve. It's not what methodology or what tools you use, it's improving. So it needs to be flexible, and therefore it's a frame of mind. It's a quality culture, it's a quality thinking that you need to take with you at the different stages of your life and move from one organization to another. It's not fixed to an organization.
How would you strike that balance, Don?
Yeah, your question speaks, I agree with what Her Excellency said. Of course, there's a balance, and we just have to be wise in the balance. Some things about improvement are standardized. You just must do it this way. It's the only way to be safe. This is the procedure. If you can come up with a better one, tell us about it, but there are rules. And as a community, we're going to share these rules, and that's the standardization part of improvement. If you only rely on that, though, you get, in the end, mediocrity and homogenization. So it's a leader like Dr. Hanan who can say, these are the rules, we're going to follow them, but I need your ideas, and I'm going to create an environment in which you're going to do constantly better. It's a combination of learning and wise standards, and we're smart enough to do that.
And I suppose then you have to be smart enough that, to realize not all innovations are equal, that, some will be fantastically transformational, some may be disruptions around the edges, and some may just not be worth it. Just because they're new, it doesn't mean that they're right.
Yeah, but trust your workforce. They will help you sort that through if you create an environment for that learning. And by the way, this speaks to our earlier panel. Creating an environment which these guys are safe to fail, where they will come up with an innovation and it doesn't work, and you celebrate the search. That's key. If we're not failing half the time, we're probably not learning.
And yet, Dr. Hanan, it's to think of taking risks in your line of work. I mean, it must be quite frightening at times.
When people don't make mistakes, it's because they're not doing anything. So I would rather people who actually try their best and make mistakes on the way than people who don't try. At the end of the day, I mean, we are all humans, so we're not machines. We're not intelligent machines like the Mindspace program, but we're humans, so we do our best. We need to help everyone and put the processes, the standards, the mechanisms for them to be safe, for them to operate in a safe platform, so their risks of making errors that impact patients directly is reduced, but they need to be able to take risks to innovate and to be free to innovate in that space.
And just finally, on this point about trusting your workforce, which Don made, what would you say to Dr. Turki and to Amani? They're young practitioners just setting out on what will hopefully be a long professional journey and one of great accomplishment. What should they keep with them, and what should they be prepared to be flexible on along the way?
First, don't be afraid of learning. Learning is lifelong. So learn from best practice, learn from forums like this one. Learn from your colleagues, learn from patients. There is no concept that's beyond your reach, and there's no person that's too small for you to learn from. So it's really important that you learn from everyone that you pass by. Don't forget what inspired you to enter this field. Keep that always in your mind, and the field can be difficult. It's long hours, it can be very stressful, and always remember what inspired you and have that to guide you. Just as a sort of a story, but I remember there are many things that inspire me, but one specific thing that inspires me is a quote that I read when I was about 12 years old, and that quote still remains in my mind even today when taking decisions. And I remember variations of it, but it says, "I shall pass this way but once, and any good that I can do or any kindness that I can show to any human being, let me do it now, and not defer that or neglect it, for I shall not pass by this road again." So remember what inspired you, whether it is this, whether it is a patient that you saw in your life, and keep that in your mind. And finally, have fun. Enjoy it. It's a beautiful field, enjoy it. It's a rewarding field, and you need to enjoy it in order to be able to innovate and to excel in it.
Dr. Hanan Al-Kuwari, Don Bowick, Amani, and Dr. Turki, thank you all very much indeed. Thank you. And thank you, Dr. Hanan, for inspiring us all, not just the medical practitioners in the room, with what you said about what we should make of our journey through life. Thank you. Your Highness, ladies and gentlemen, excellencies, we've spent 2 days here. We've talked about many different ideas. But as you all know by now, WISH is not a conference, but a year-round meeting of minds.
WISH is a global community that brings together thousands of global leaders to tackle some of the world's most pressing healthcare challenges. Here in Doha, we convened policymakers, health system leaders, providers, and researchers because innovation depends on the support and interaction of all stakeholders in healthcare. Our common goal? Sharing and debating the evidence base for more thoughtful policy and delivery system reforms, as each country strives to achieve better and more equitable health outcomes at sustainable cost. Since it was founded, WISH has published more than 1,000 pages of research and provided a distinctive platform for world-class leading innovations. This year, 11 new reports have been added to our growing knowledge base, delving into some of the most complex issues facing the global healthcare system today. As a global community of leaders, we have the privilege and the duty to spread ideas and solutions for the benefit of populations everywhere. WISH, a healthier world through global collaboration.
So WISH is a community, and I want to end by telling you what that means in practice and what WISH asks of you, because among you are many experts in different fields with so much to offer. And being part of this community of WISH means that a call may come at some point. It may ask you to help reorient a health system around the needs of a patient, to help with the curriculum of a medical school somewhere in the world, to share technology you have developed, or to help spread an invention. To name just one, the 3D model that I saw in the gallery of a foot used to teach people how to treat diabetic foot ulcers. So when that call comes, and I'm going to say when rather than if, please take it and use your expertise for the benefit of others who are in the part of this community. It's part of the continuing mission that brings us all together. I'd like to thank everyone who played a role in doing that and bringing us all together. Thank you, Your Highness, for your vision, which is where it starts and which gives it a continuing push forward. So thank you all very much, and until the next WISH, goodbye. Thank you.